How do you introduce retinol into your skincare routine? You may have heard and read some scary things about people getting soreness, dryness, irritation, redness, and of course that can happen because it is a side effect of retinol, or indeed any of those ingredients that form part of the vitamin A family, otherwise known as retinoids. So what do you do? Well, what I would say is if you do have sensitive skin, then perhaps think about starting it when your skin is as calm as it can be. You need to hydrate it first, get it ready for something stronger like retinol. And when you introduce it, avoid the sensitive areas like around your eyes and maybe certain areas on your face where you do get more sensitive skin. I would just take 1 drop of serum or cream at night, not before an important day the next day if you've got an important event or something, and just apply it to a small area of skin, preferably around here on the face, lower face and neck, and just watch what happens over 24 hours. If it's okay and you don't get any problems, you can then introduce a little bit more to the rest of the face and again wait 24 hours and make sure everything's okay. I would then initially use it maybe 2 or 3 nights a week, making sure you have at least a night's gap in between, and see how you go for a couple of weeks. If all is still okay, you can then gradually build up. Now for many people and for many forms of retinol, that is actually all you might need. But if you are under a skin practitioner or you feel you do need it more regularly, then you can build up to nightly. But again, that's when some people can start getting the side effects. Now, retinol tends to be the most popular because it's a happy medium between having something strong enough that's actually going to do something, but actually not too strong like prescription strength, which is things like tretinoin, that can almost certainly in most people cause some side effects, certainly for the first 4 to 6 weeks. However, there are some newer forms. Retinol came out in the 1940s, as did tretinoin. We're now in 2025, and actually there are so many newer generation versions of retinol. And my favorite is in the retinase product from Solderma. And this is a gram-active retinoid with some adjunctive, amazing ingredients. And what it does is actually takes away all those hurdles. So how I told you need to introduce it, you don't actually need to do that with this form of retinoid. Most people can just get going from the outset with little concern that they're going to have any irritant side effects. Of course, it's not impossible, but 99.9% of patients will actually say to me they're absolutely fine with it, and you can get going even in the summer, even around your eyes in most cases. But if you're going to use any other brand or any other form, I would follow the advice I've given earlier in the video just to be on the safe side. And really, if you do this, then if you've got breakouts, if you've got pigmentation you're dealing with, lines and wrinkles, you just want to maintain good skin health, this is a true all-rounder like some of the other great ingredients I've done videos on.